So my name is Monika Sanghavi, and I'm actually currently a fellow at UT Southwestern Medical Center in Texas, Dallas, Texas. So the main purpose of my study, actually the premise of my hypothesis was based on the observation that postmenopausal women are at increased risk for cardiovascular disease and metabolic abnormalities. And what I was looking at, and also we noted that people with hepatic steatosis are also at increased risk of cardiovascular risk and metabolic abnormalities. And so what we were looking at are, do postmenopausal women have an independent, is postmenopausal status independently associated with increased hepatic steatosis? And so what we looked at was the Dallas Heart Study. We took a population of about 1,000 women in the Dallas Heart Study, and we looked at postmenopausal women and premenopausal women and their current, basically their prevalence of hepatic steatosis as measured by magnetic resonance spectroscopy. And what makes this unique is that it is a very sensitive and quantitative way of measuring liver fat. So what we found was that there was definitely an association. Postmenopausal women had increased amount of liver fat, and this was done in a categorical way as well as a continuous variable. In both ways, we noticed that there was an increased amount of liver fat in postmenopausal women. Then what we did is we controlled for obvious confounders: age, BMI, waist circumference, diabetes, HOMA-IR, and even using basically adjusting for all these variables, we still saw an independent association between postmenopausal women and hepatic steatosis. Then what we did is we actually stratified it by time since last menstrual period. Since we defined menopause status as basically 12 months since your last menstrual period, which is how the OBGYNs also define it. And then we stratified it based on those who had last menstrual period within 2 months, 2 to 12 months, and then greater than 12 months. And what we saw was a graded association, so a graded increase in the prevalence of liver fat in these women. So as they were farther out from their last menstrual period, they had increased evidence of liver fat. And so from this, we concluded that postmenopausal women had an independent association in terms of increased liver fat. And in terms of what this could mean, we don't know for sure. This is all speculation, but one thought is that maybe estrogen might be at play here, and this might be a mechanism by which postmenopausal women have increased risk of cardiovascular disease, but that's still yet to be determined. And I'd also like to thank the American College of Cardiology for recognizing this research with the 2 awards that I have on my board, Best Poster overall and Best Poster for the FIT, the Fellows in Training category. Thank you.